How to Make America Utopia, Take Away the Economy from Those Who Rigged It. As I See It, Class Warfare, The Only Resort to Right-Wing Doom. It's Worth It, How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, and other books written by Willis. Welcome to Politics Done Right. I'm Willis, your host. Good morning, Houston. Good morning, Harris County. Good morning to the great state of Texas. Good morning to Northeast Texas, Southeast Texas, Northwest Louisiana, Southwest Louisiana, and all the nooks and crannies receiving the signals from our 100,000 watt transmitter into the boxes. Used to be called radios, now they're called Howard boxes, Howard Reynolds boxes that receives all our signaling from that 100,000 watt transmitter. Of course, as well, good morning to the entire world who receives our signals via the magic of the internet, formerly known as ARPANET, controlled by whom again, or created by whom again? We the people, not the billionaires who are using it to monopolize AI and everything else. Folks, we've got to take it back. Without further ado, let's go to El Estudio, the studio with the two geniuses that are there making things happen.
Where are those guys?
It's just two sleepy people here.
There's only Jack and I here, and we're far from genius. Well, Jack is pretty much a genius, but I'm very far from it. Good morning, Egberto. Howard boxes, huh?
Yeah, I'm going to start calling it that because a couple of shows ago, you gave a whole long instantiation of a special kind of box that had quadraphonic sounds and all. I'm like, man,
yeah.
You know,
that was the Sansui.
Yeah.
Sansui QR 6500. I've got one upstairs that just blows the house down. I continue to get in trouble with it because our interim general manager, Sandy Wyman, says, turn that down, it's too loud. Says, but you got to feel it, Sandy. If it's not rattling the bones in your body, it ain't working, man.
Yeah, I remember there's a song called Guys Like Cars That Go Boom. Well, Howard likes radios that make everything go boom.
Oh, yeah. The deeper the bass, the higher the highs, the better it is. So here it is Friday, and this weekend, come join us on Sunday afternoon from 5 until 7 at Under the Volcano for a live performance of Clint Broussard and Blues and Hi-Fi. We'll be doing a remote out there, a remote broadcast out into the public, as we love to do, because we like to meet folks. We like to say, hey, let's put a face with a name. The guys who call in, the folks who listen in, the folks who donate. We want to meet you. We want to meet you in person because we like you. You support our station. So therefore, we like you. And we want you to come on out and have a good time. And meet Clint Broussard, because Clint is one of those musicologists. He knows all his stuff, and he's very smart. Not a bad-looking guy either, but that's that's for the ladies. Come on out and meet Clint Broussard at our Under the Volcano remote on Sunday, 5 until 7. So we'll see you there. And Jack, you got some wisdom for us today?
Yeah, I got a little bit. Kind of seeps out around the edges from time to time. Good morning, Egberto. How are you?
Good morning, Jack. I'm doing fine. I can't wait to hear what you got to tell us.
Well, it's going to be about your post on the healthcare today. Mm-hmm. The richest country in the world ranks last in healthcare for its citizens. Why? Because the big healthcare vampires have their fangs embedded in the necks of John and Joni Q taxpayer. Not only are they collecting your premiums and denying you services, if you have a Medicare Take Advantage of You policy, they charge Medicare for your care at a profit. So the X are double dipping. Remember Seinfeld, double dipping? You double dip. So
Go ahead.
They're dipping into taxpayers' funds as they privatize their profits and socialize their cost. That's their MO.
Those rats.
Those
Those
Grinches.
rats. Oh,
Mm-hmm.
yeah. Well, you know what? It's interesting because today I have two videos, and I think I'm going to actually start the show with one to make that, to start out with what Jack picked up on, and then we're gonna move on. But this is so important, and I love the way the young lady who was on the panel that on what I'm going to play ended. Politics matter. We're gonna do that, and then we'll be right back. So let's go ahead and get started with that, and then we'll move on. Every year, the Commonwealth Fund goes ahead and does a test of the different healthcare systems around the world. And we, without doubt, always come out last. Why do we come out last? Because we don't have a healthcare system. We have a sick care system. We have a system that depends on solely on money, a system that is a profit-based system, which means they don't really give a damn about your healthcare. What they care about is using your health as a widget to make somebody a hell of a lot of money. That is what our system is based. That is why you see private emergency rooms coming up all over the place. Investment bankers are creating new funds that take care of health insurance or that take care of creating all these little Walmart type healthcare system. They're not looking at healthcare to help you. They're looking at healthcare to simply make money. And that's unlike the rest of the world. Canada and all these other countries have some form of universal healthcare, some of them better than the others. Of course, the best would always be a single payer system throughout, because again, it's the most efficient, but we don't have that we don't have that here. And we don't have the care. We have the people completely brainwashed into thinking that a real healthcare system, it cannot exist in this country. Something that we really need to mitigate quickly. But I want you to listen to this little piece by on MSNBC, and then we'll take it on the other side.
The healthcare system in the U.S. is failing, according to a brand new report comparing American healthcare to 9 other developed countries. According to new data, people in this country die the youngest and experience the most avoidable deaths, even though we spend nearly twice as much on healthcare. Joining me now, former White House Health Policy Director under President Obama and MSNBC medical contributor, Dr. Cavita Patel. I found these results shocking that even researchers say the U.S. stands out for its exceptionally weak performance. Are you surprised? And if not, how does it manifest itself for your patients?
Yeah, Chris, I'm not surprised, sadly. This is a study that the Commonwealth Fund has been doing over the years, and they compare health system performance across 10 countries, including the United States. And they compare them to kind of like countries, Australia, Netherlands, United Kingdom, France. And when they looked at all of these countries across 5 areas, access to care, care process, administrative efficiency, equity, health outcomes, Chris, it's no surprise that we're ranking very low, if not the lowest in overall performance. It manifests every day with patients. Access to care. Think about how long it takes to get an appointment. Think how long it takes to get in to see a specialist. Add to that if you're on Medicaid. I'll even make it easier. What if you're in Texas? They didn't expand Medicaid. Or Florida, states where they have not expanded access, where we have the ability to do it today. That's why we're seeing these results.
Yeah, just try to get in to get an MRI or a mammogram or, 6 months.
Yes.
Anyway, the report says that the U.S. Has the lowest life expectancy and the highest rate of preventable and treatable excess deaths. What are we doing wrong? Can we reverse this trend?
Yeah, I think we need to move from I say this and I take a lot of humility, Chris, because I'm part of the problem. We have a sickness system, right? As doctors and professionals, we respond to sickness. You go to the hospital, you go to a doctor when you don't feel good. Chris, what if we inverted that pyramid? What if we paid health coaches, primary care doctors, pediatricians, people on the front lines, what if we paid them the most? This is sometimes what we see in other countries to prevent illness. And it's just something that we're starting to get a little bit better about prevention, but none of us want to be sick. All of us want to live longer. I want to be active to see my kids grow up, have their own kids. So why don't we start paying for those outcomes? And I think because of the way the insurance system is designed, the fact that we're still tied to kind of year to year, you might change your plan next year. So that plan doesn't know that you want to work on prevention, and that we have such a distance between our providers and our patients. So there's a gap between us. sometimes a physical screen between us. We don't even get to look patients in the eyes. We need to change that equation, and we have the power to do so. I love election years for this because this is a top voter issue. I'm hoping both candidates, Trump and Harris, get to talk about what they're going to do to reverse these trends.
Now listen to how Patel ends that thing. I love election seasons because that is a time where we can get the messages out of the candidates, and we can also impart messages into the candidate. But what's interesting in the debate where they asked Donald Trump about Obamacare, where he said, yes, I want to kill Obamacare, which is not the best healthcare, but it's better than what we've ever had before. Well, he says, yes, I want to kill it and make it better. And they asked him, what about a plan? Well, I have a concept of a plan. Well, this guy has been attempting to kill Obamacare for 9 years. John McCain saved us from disaster just before he died by voting the last bill to kill Obamacare down, and he's still with it. But what does he have to offer? No plan. America, can't you see this man has no plan for neither your healthcare or your country, our country? Come on now. Now, look, the only healthcare system that's viable, the only healthcare system that works is one where we are all in one risk pool so that we don't have insurance companies cherry picking who they want to have as clients. The only solution is a single payer, non-profit system, bar none. You cannot have your healthcare dependent on the profit of individuals or on the profit of corporations, etc. That cannot work because you never know if your healthcare is dependent on somebody making a profit or what's best for you. Have you been to a dentist lately? Do you really need a root canal, or can they just do a fill-in? Do you really need a crown, or can they just do a fill-in? When you are in a system where profit is the motive for healthcare, you can guarantee that your healthcare takes second fiddle to what really has to get done. Folks, it is time for us to wake up. A single payer healthcare system is our only solution. And what we have to do is force politicians to do exactly that. That is what we have to do. Force politicians to do exactly. I want to pick up on something Patel said that is so important. She says, we are a sick care system. And she says why it is that we don't take care of things beforehand. And she said, why is it that we don't give pay the family doctor more than the specialist, right? And it's a typical inverted pyramid in even the way we pay folks. I talk about the disease in our economic system being a fraud, and even in the healthcare industry, it works out that way. Let me show you this. A kidney specialist makes a lot more money than the family practitioner. I want you to think about this well. A kidney specialist makes a lot more than the family practitioner. But who actually does the most work? Who actually is more beneficial to society at large? Yes, we like specialists, somebody who can sit and spend all of their times studying all the ins and outs of a kidney, but it's one thing, right? But you have the family doctor that when that patient comes in, he has to look at the patient in the aggregate in a holistic manner. He has to figure, does this need to be sent to the person who knows the kidney, or does this need to be sent to the person who knows the heart, or does this need to be sent to the person who knows the intestine? He has to be not only a traffic cop, but he has to have great deductive skills, etc. And as he or she participates in the medical field more and more years, he gains the experience, she gains the experience of knowing where or what ails the body, before they have to go ahead and send to a specialist whose concentration is going to be that one organ, that one disease, that one thing. But in our inverted way of thinking, they say, well, the specialist had to go and get some more training for that one thing. But you know what? The family practitioner, that doctor that sees everybody, is in practice to understand everything continuously. But again, in our thinking process, We somehow value that person that only has to worry about that one organ as opposed to that person that has to be holistic. The same thing we have in industry, right? The person who moves the capital, the dollars, make all the money in our society. But then that person who does the work is subservient to the person who has the capital. And then we say the person with the capital risk their capital without taking into account that the person that goes into work every day risk themselves during transporting themselves to work, risk themselves for the environment in the work, both psychological and physical. I mean, we are a society that has been taught we have been taught to minimize those who work the most and maximize those who work the least. You doubt it? When somebody says, I am smart because I make my money work for me. Well, guess what, people? Money works for no one. We simply have a society where those who have money, we can sit it down and have others do the work. There's a time we used to call that slavery, right? So, I mean, we have a mode, we have been taught a certain modal, a certain way of thinking where we minimize those who are worth the most and maximize those who perform the least. And it's the same in our healthcare system. We spend the most in the healthcare system in America, the most, more than anyone else. Yet we are so, our outcomes are terrible compared to the rest of the world who actually see the humanity in having universal health care. And unfortunately, the cancer, the disease that we have in the for profit system is starting to infiltrate even some of these systems, degrading them. The national healthcare system from England, from the United Kingdom, one of the best in the world, as soon as it started to offshoot some of its services to the private sector, it has started some degradation because again, what it has done, what certain parts of the NHS is doing, and I've covered that before on other shows, is to move it to the private sector where profit is the motive. Look, I have nothing against profit at all. I've had 7, 8 businesses before. But the one thing we have to acknowledge that there are certain things that don't belong in the profit domain. There are certain areas where profit is a hindrance, profit is an expense, profit has us making the wrong decisions. If we use profit in the healthcare domain, we cannot believe that that any entity is going to put that person's well-being, that person's health, that maybe that person needs a heart transplant, but we can't do it because it'll hit the bottom line, but we can prop them up with some sort of medicine to keep the cost low. I mean, we have to start thinking humanely. We have to start thinking of our well being. We have to start thinking about people first. Business is there to make people first. Business should be there to support us and not the other way around. I've spoken many a times being on panels where we'll have a conservative, a moderate, a left winger like myself on the panel, and we start talking about economic policies. And somebody would throw out a policy there, and the person on the conservative side, on the business side, would say, but how would that affect business? The wrong question. The question should always be, how does that affect our life? How does that affect humanity? How does that affect the way we live? And we build businesses around what makes life better for us all. We have to start putting people first, humanity first, and not business first. When we put business first, we kill the environment because you know what? That's another problem. When we put business first, we lose our forests. When we put business first, all these things that makes us sustainable, all these things that make us, yeah, the word, happy we put last. It is time for us to really start believing in ourselves. It is time for us to start thinking. When that business person comes out and tells you those are damn socialists trying to do X, Y, and Z, remind them that what socialists are doing right now are propping up business. They've socialized business. Ask yourself why a student, a person who got a student loan and they're in dire straits with bills, they cannot get a bankruptcy, but a company who you can use bankruptcy to get away from their bills. Companies have used bankruptcies to stiff myself out of monies they've owed me. Bankruptcy have had me have to pay back a company who paid me because they got bankrupted within a 3-month window. Business first. Let's start thinking people first. From healthcare right back. All right, folks, the telephone number is 713-526-5738. Again, that number is 713-526-5738, extension 2 to come on air right away. I would love to hear your thoughts. Are you having medical issues? Are you having issues that you have from a paying a bills point of view, etc.? Give me a call, 713-526-5738. We have our great brother Harry on the line. Come on in, Harry. How are you doing this morning?
Happy Friday. Buenos dias. El Professor Bertha Willis. Good morning, Howard. Good morning, Jack. Well, I've talked about healthcare in the past. That's not what I really called about. But everything you said there in the monologue of the piece you played, Burrow, is absolutely correct. We've got to have people over profit, and not all these insurance. And as the mayor of politics done right said the other day, he'll probably call again this morning, is we got to get the middleman, the insurance companies, out of healthcare. We've got to have single payer healthcare, as you pointed out, as Bernie Sanders has pointed out. You're a Bernie supporter, but I'll go on to my other points. With Arnie Arneson yesterday, or the last few days, she was talking. The other thing I didn't mention when Nicole and Neil Quinn were on is the undocumented workers. They don't even get paid time and a half for doing that agricultural work. It's just how much they harvest, and I feel that that's wrong, that they're being exploited in that sense. And then I'll go on to J.D. Vance. J.D. Vance is up here talking about that the Haitians that have come here and are legalized and are permitted to work is up here talking about, and I heard Arnie Arneson talking about this with our guests, oh, they're still illegal and they need to be deported anyway. No, because they have a working permit and they're here legally. But he'll get up there and tell that lie. And then, Berto, I was reminded again yesterday when I was working on my cleaning out my refrigerator why I am a protest voter and I cannot vote for Donald Trump or Kamala Harris. I heard Donald Trump on NPR yesterday talking about I'm a big supporter of Israel. Israel has a right to defend itself. If you vote for Kamala Harris, the state of Israel will end. And he went on to say that when he was talking about Israel, that we're going to give Israel everything it needs against Hamas. And I just keep thinking about Rashida Tlaib's people. The Judean people are the ones who are going to lose here. They're the women and children that have nothing to do with Hamas. That little girl who can't go to school, play with her friends because 2,000-pound bombs. I know Kamala Harris and Joe Biden are working to stop giving Netanyahu those bombs, but it's just sad, and it saddens me, Roberto. We talked about this before. I know how it pains you, and it hurts me too. But that's why I'm voting for Dr. West. I'm a protest voter because I feel that Kamala Harris and Donald Trump are on the wrong side of this and giving Israel, to fight Hamas and all that, and Hezbollah with the pagers blowing up and all that. I understand all that, but there are innocent people being killed here who have nothing to do with that, and that's really saddens me, Roberto.
Okay, let me come back and first of all, good points that you brought up here, and let me tell America has a policy towards Israel that at this point in time is unbreakable. As long as there's APAC, as long as there are external forces that have the power that they have, Israel will have whoever is elected president, Israel will have an unfair advantage over the other countries, and that will stay that way until progressives and others, including many Israelis right here, I mean, many Jews right here in the United States who agree with us that the Israel policy is wrong. Until we are able to make our case better, we won't get a more equitable solution in Israel. That said, we are not, I will never be a one issue voter. And specifically, maybe in Texas, a protest vote is okay. I hope that if you were in Wisconsin or if you were in Michigan, that you would look at your own personal requirements in life, including that which you, let's say, get from the system, the government for that matter, because of things, many of it outside of your control, and realize that you don't have the what is the word that I use? Your life does not give you that opportunity to have that protest vote, because a protest vote means the demise of your own personal economy. So I hope, like I said, a protest vote in Texas is not all that bad compared to a protest vote in Wisconsin, Michigan, Pennsylvania, uh, or one of those places. Because I tell you what, a lot of people that I hear talk about protest vote, if I see that they're in Pennsylvania, I said, okay, that is like saying, okay, this is my conscience speaking about Israel. But what about the
Right.
conscience speaking about the food that feeds many others? So I hear you, Harry. Again, in Texas, I'm not going to give you a hassle in Texas. If you're in Pennsylvania, I would. But thank you, my brother, for your smart commentary as usual. All right?
Yeah, one more.
Yeah, go ahead. All right, let's go to brother Mike. Come on in, Mike.
Good morning. Can you hear me?
Yes, I can.
Yes. In relation to Israel, I think their power angle is that they're like a proxy for the U.S. to fight against Iran.
Okay,
Because
could you hold on, sir? Could you speak a little slower, because I think you're coming across with sort of a echo or stuff. So please go ahead again. With regards to Israel.
in regards to Israel, I think they have that advantage of being a proxy for the U.S. to fight against Iran because they have a lot of clout and a lot of pull and power to the U.S. What's your opinion about that?
I mean, I think you nailed it, right? I mean, the question is, who's the puppet? Is the United States the puppet, or is Israel the puppet? Well, it turns out that Israel yes, Israel is a puppet that that many times go off the wall and do the things that we will get them blamed to do, but we really don't mind that they do. Okay, in other words, they're keeping a lot of those people in flux and in check to some extent. So I think you nailed it. The question is, how do we balance that? I am in complete disagreement with our Israeli policy, because I think it follows that we must be dominant in the region modal. You see, having Israel over there pretty much protects quite a bit for us. So I think you nailed it, sir. Anything else you want to add, Mike?
Yes, about health insurance. What brought that mandate that's requiring us to have automotive insurance when we, as the people who pay for these autos, need our health before any material thing? So that needs to be researched and at least explained to us, or someone explained to us, that that same path they took to get that mandated, that we all, if we have automobiles, have to have insurance. We as citizens should have insurance.
Oh yeah. I mean, the thing about it is, you're kind of muffled, so I hope I understood the question correctly. We must have car insurance. We should all have health insurance. Let me tell you where I differ. I differ that I don't believe health insurance belong in the private domain, because again, it for profit means that you're putting your health at the behest of some company who depends on doing the least to make sure they make the most profit. So I don't know if, like I said, you're muffled. I hope that sort of answered the question. All right, let's go ahead and go to Patrick.
Hey, good morning, Roberta. How are you?
Muy bien, señor. Talk to me, my brother.
Heard you on you talk. Was good. I'll touch on Israel, and actually, I should look at us. I think a very, very simple tweak to our military policies would fix both proxy wars right now. And it's not original to me, but it's made the most sense. We should have, as a country and as government, a policy that we will not sell arms to anybody who is not in current negotiations for a ceasefire. That should be number one. You do not sell arms to anybody that is not actively trying to stop aggression. But that's also not why I called. The medical industry in the United States, what we had was a socialist model. It was a service. It wasn't something done for profit. And when we allowed, or when people forced capitalism into it, it started to fail. Our life expectancy is shrinking. Our health is shrinking. We couldn't respond to a pandemic. And you can look at other socialist countries that are still socialized medicine, and even ones that are cut off in sanctions, their life expectancies are increasing. They came up with more vaccines than we did. They've done better for their people that way. And anybody in those countries can get the education for an upper level medical industry paid for. This is a very good example where we can concretely say capitalism does not work in every area. How many levees, how much flood control has capitalism built? None. It's never going to protect us.
Well, I mean, that is by design, right? I mean, they like to define capitalism as the efficient allocation of resources. And that sounds good. You listen to any Milton Friedman, the New Capitalist, or I spoke to Tom Hartman, and he was bringing up the Wealth of Nations by Adam Smith, and you take a look at the premise behind capitalism, and the truth of the matter is there are certain aspects it's good for, or it works, but there are certain areas where it simply cannot work. And if you just look at the definition, it tells you the efficient allocation of resources in healthcare has no value to humanity, right? Because the best you gave a good example with levees. Levees are dry most of the times. Levees are dry most of the times, or what's behind the levee, or what's the levee is built for, is dry most of the time. If you doubt it, go out to 1960 in Houston, where it's bordered by the Barker Cypress levee, and you'll find that behind there are parks. But when comes the big flood every couple of years or whatever, behind there becomes a lake. But it protects Houston. But capitalists don't see a value in putting that kind of investment into something that may be used in 1 year, or may be used 10 years from now. But when it is used, it protects the lives of people. But guess what? If the levee is not there and the whole people are flooded downstream, even that is good for capitalism, because it creates a new source of income to rebuild, etc., not taking the value of humanity, of the pains that humans have to go through to rebuild. We could build hurricane-proof homes. We could build a whole lot of things, but it doesn't make sense in a capitalist society. And when it comes
because
to
it won't grow
healthcare,
GDP. Because it
exactly.
won't grow GDP. We've all been convinced that we need the economy to grow. We need the economy to grow. You know what? If we cured cancer, if we could make a cure as like a vaccine for cancer, man, this economy would crash, but we would be better off.
Wait, let me correct that though. I mean, you hit something very important because I always say this. Let's use Walmart as an example. Walmart stock has a particular price. And the particular price of Walmart has nothing to do with the total asset value of Walmart. So what that means, if you were to calculate all the trucks they own, all the stores they own, all the material in the stores, etc., and divide it by the amount of outstanding stocks they have, you'll say, "Oh my God, why is Walmart stock so high?" When if I were to sell all the material within Walmart, it won't equate to that stock. Well, there's this false thing they have called, well, it's future growth that stock has that high price for future growth. And then you see how corrosive future growth really is. Let's give an example. If we go ahead and Walmart sells chicken and it sells all these things at a standard price and that price stays consistent, right? That company will be making a profit, a solid, let's say 3 to 5% profit. Every day it'll make its solid 3 to 5% profit. But you know what it doesn't have when it makes just a standard profit? It doesn't have growth. It's steady state. In other words, it can pay its bills, it can pay its customers, it can pay stuff, and it can pay a fixed, short, small dividend every month, the excess that it makes. But in the stock market parlance, in what the stockbroker and these people in the stock want, that's not what they want. They want growth. And the thing about it is, if you understand math, you understand that you can't have a certain percentage growth that is greater than the total growth of the economy plus inflation. You can't. It's a mathematical impossibility. And therefore, the only way to mitigate that for the class that has income, I mean, that makes their money from capital, is for them to take it away from the other, the rest of us. And that's exactly how capitalism is behaving. Income inequality, wealth inequality, wealth disparity. It is when people talk about fixing it, it's working as intended. If you want that kind of growth, it has to come from somewhere. And that somewhere, it's from you, we, the people, to the few. That is what happens. Patrick, close her up for me.
Okay, I appreciate all the extra time. One more myth about capitalism that I like to bring up a lot is that they speak about it inspiring competition and
That is, yeah, that's stuff they say, but it's false. Yeah, go ahead.
it's absolutely false. If it was true, we wouldn't have a shrinking number of corporations. We wouldn't have a shrinking workforce. We wouldn't have corporate sabotage. The number one. Go ahead.
Patrick, let me interrupt you because I want to say it's even worse than that. You made it nicer than it really is. Let me tell you the evil within it, right? The excuse that they give for capitalism and why we shouldn't mess with the profits they make and all that kind of stuff is because it would stop innovation. That is what they say. It will stop innovation. But unfortunately, the lie is this, and I want everybody to hear this concretely. The lie is in. The people who innovate are not the people who really profit from the spoils of capitalism. It's the person in the boardroom. It's the person that receives the dividends for doing absolutely no work that profit from the policies of capitalism. The engineer who invents, the scientist who discovers, those are not the people that are billionaires. So therefore, how can you say that innovation occurs because of this particular economic system when the people who are innovating are salaried employees? They're the ones with the intelligence. They're the ones with the intellect. They're the ones with the performance. They're not the ones that get the massive amount of monies at all. So let's get some honesty into it. Thank you for bringing that up, Patrick. And I got to start going to the other calls. Every line is full, sir. Thank you, brother.
Yes, sir. Thank you. Have a great day.
All right, let's go to Brother Tag.
Good morning, Edberto.
Good morning, sir. Talk to me.
Well, I was going to talk about voting, but then your capitalism thing was a good topic too. Just a quick word about capitalism. One of the things I don't think people consider why capitalism doesn't work is because, like in the example of an employee who comes to work at a job, they are not going to make you any money for quite a while until they learn the job and are proficient at it, right?
Right.
So they're dead weight. And it's the same thing with a small business. Quite often, a small business will open up, and they don't make any money for quite a while until they build up a clientele base and they get their product fixed up good. But the thing is, so there isn't any reason for capitalism to get involved in those two areas for employees or new businesses. There's no money in it for capitalists.
I am so glad you mentioned something so important, Tag. Tag, you mentioned something that is even more important that I mentioned. When Jack spoke about capitalism, he said it's no longer vulture capitalism, it is actually vampire capitalism. That came from our genius in the studio, Jack. All right, let me tell you why you just proved that. What they do is the following: a person gets an idea and they form a small company, and they work hundreds of thousands of hours for this idea. I developed a product called ComDRV that way. I slept on 3-4 hours a day for years building the product. Now here's the deal. And then when the product is successful, the capitalist comes in and say, "Oh wow, I like that. I'll pay you off, and then I'll go off and eternally make money on your idea." They didn't create anything. They didn't innovate anything. All right. But what they did is they had the capital to buy the thing or to enslave to build the thing. So good point, Tag. Continue, my friend, and then I got to go to Derek. I'm running out of time.
Well, I've even got a better one about these people who don't want to vote because they don't like either candidate. This one's really going to hit the nail on the head. At this point, we basically have the option of one of two candidates for president, and which one of those candidates are going to be more pliable to our needs and desires? And Obama said it best, that he said, "You can get me elected, but you've got to hold my feet to the fire to get what you want done."
There you go.
And the fact is that Trump has no feeling in his feet. So you're never going to get him to do anything that's good for us.
Tag,
and that's why I think. Go ahead.
Yeah, I just want to say you nailed it. I got to go to Derek, but thank you very much, Tag. I'm running out of time, and it's my fault that how I manage it so far.
Let's remember that second point so we can get people to vote.
Thank you, sir. You made it. Let's go to
Bye-bye.
Derek. Thank you, Derek. Thank you, Tag. Come on in, brother. Derek, come on in.
Okay, well, I guess I'm going to go vote because I've been a non-voter for I don't know how long now. So I guess he convinced me to go ahead and vote.
Good.
My question is, hypothetically speaking, going back to Israel, hypothetically speaking, if Hamas were to win the conflict, if they were to overcome Israel, what would hypothetically be the outcome? Politically, geographically, culturally?
You know what? That is a very good. That is a very good thing. Okay, because that's not what we want. I don't want it to be just a Hamas win, because Hamas is a very what is it kind of the culture of Hamas, that organization, that terrorist organization, is one that suppresses women and all that kind of a stuff. Yeah, we know that. So the idea is not to have Hamas beat Israel or anything like that. You see, for those who think that is the argument of those of us on the left, no, you're wrong. That's not what we're talking about. We're talking about the humanity of absolutely everyone, irrespective of their cultural tendencies, irrespective of who they are. We're talking about the humanity portion. I wouldn't want to be living on, if I had to live under Israel or Hamas, you bet your life I would be picking Israel because it is more in concert with a democratic system, more in concert with and actually, to put it bluntly, Israel is a socialist, a pseudo-socialist country where healthcare and all these other things are done. I know you know about the kibbutz and all the way that operates, etc. So no, I think I get the point you're trying to make, and what I'm saying is let's be more nuanced. Okay, Derek, real quick, so I can go to Art.
Well, that's a good insight. Thank you, sir.
All right, you have a great day, sir. Let's go to Art. Come on in, Art. Brother Art, you're on. Art, are you there? You're maybe on mute. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Let's go to Roland.
Hello.
Yes, you're on, Roland.
Oh, good morning.
Good morning.
I've got a question, but it's about auto insurance.
Okay.
The form for the consumer to protect themselves, if possible. Just recently, when the hurricane was coming through and it went, it swayed it another way, I was adding a vehicle, and from one day to the next, I went from them asking me $100 to almost $300. Okay, but there was no threat, actual threat here in Houston. So I guess for myself and from consumers' point of view, what can you do to maybe protect yourself, from such things like that?
Let me see if I understand you right. You're saying that your insurance went from $100 to $300?
Well, I was trying to add a vehicle at that particular point in time, but I already knew that the hurricane had went somewhere else, right? But they told me, well, for one day it was 100, the next day it was almost 300, just to add a vehicle to my policy.
I got you. To add a vehicle to the policy. Let me tell you about, insurance is the biggest racket out there, right? In other words, they want to collect a lot of money, but they want to pay as little out as possible. That is their profit margin. And they a lot of times you have insurance companies that charge X amount of dollars because we haven't had a hurricane or something for a long time, and their competitive advantage is to keep bringing the price down. And since they're not using the money, hey, they brought the price down for a long time, and then a big hurricane comes and it destroys a whole lot. And even though your area may not have been hit, that one insurance company may have been in Houston, it may have been in New Orleans and all these other places, so their books get hit. The books that they have for all the people that they've insured get hit, and the only solution that they have is if any new insurance that they write, they have to increase that price so that they can bill back their monies. Look, I don't I don't have an answer specifically because again, it's all numbers, and since we have the insurance company in the private domain and their sole thing is to make a profit, well, that's where we have it. Now, we as a society, and I'm not advocating or disadvocating this, but we as a society can decide that this is not how we want insurance to work. And in doing so, we can say we want socialized insurance at a part that works at a particular price where there isn't a profit motive in there. We could do that as a society, but until we build that up, the all I can say is that you are in a supply and demand and profit environment with your car insurance, just like we are in the health insurance. I wanted out of the health insurance completely, but hey, that is where we're at right now. So it's not an acceptable answer that I'm giving you as far as what we can do. What I'm saying, what there is something that we can do, and that is if we want to have insurance operate outside of that behavior, we would have to force our politicians to do it. We can, but it's an uphill battle to convince Americans that that's a preferred way to go. I hope that answered your question partially.
Yeah, I see.
Thank you, sir.
Thank you.
You have a great day. Let's go to Brian. Come on in, Brian. Brother Brian, you're on.
Yeah.
Okay, yeah, thank you. All right. Now, there was right about 1 million people that were removed from the voters' rolls, and y'all need to stop with the fear tactics. About 480,000 of them were actually dead. 200,000 had moved away, didn't respond to the questionnaire that was mailed to them. 10,000 were felons, and 5,000 were illegal aliens. So you need to stop with your fear. If you just continue to vote, you're automatically replaced on the rolls. Now, here's a question for you: are you a Marxist? Are you a Leninist? Or are you a communist? That's my question.
Okay, your question to the day is I think, okay, let me answer the question. You need to go ahead and learn the definitions of all of those different forms of economic systems. If in I like to call that eco-political systems. The reality is, I am none of them. None. Absolutely none. People want to call me a communist. People want to call me a socialist. People want to call me anything. I am a humanist. And let me tell you what I mean by that. I le- are you going to let me answer to tell you who I am and not let you define me? Let me tell you who I
How
am.
does it feel to be cut off?
It's guess what, sir? It's not a well. Anyway, I'm not going there. Let me explain to you what I am. One, I am a humanist. I believe in human values, and I believe in policies that ensure we have a pleasant life, a happy life, a joyful life. Just like the Constitution says in the beginning, I believe in the well-being of us all. Now, how do we implement that? You may want to call me a socialist sometimes. Sometimes people call me a capitalist for what I believe in. I believe there are areas of our economy that should work. I hate to use the word capitalism because that that bifurcates capital from work. So I'm going to say I believe in free enterprise. That, in other words, a place where if you're person, you can create your own business and you profit from the amount of work you want to do in your business. I believe that wholeheartedly. I believe in supply and demand. If there's something in short supply, you increase the price of that stuff so that more of it will be made. Okay? That works. But I also believe in what many would call socialized medicine, because medicine does not belong in the private sector, because I don't know when that private sector healthcare provider is there to make a dollar and reduce my care because they need to make a profit for their shareholder. That's why medicine and capitalism should, or for profit, should never be in the same domain. So I can explain myself, and I'm not going to be placed in a box of communist, socialist, capitalist at all. I look at what Americans and people need, and that's how we should write policy for the needs of people. I will not be placed in a box. Thank you very much, Brian. You have a wonderful day. Let's go to.
No, you're continually talking about working off the backs of others. That makes you a Marxist.
No, that's what you want to define it as. You want to define it. No, somebody who wants to make money off of the backs of others. That's a master. It's called a slave owner. And maybe you should learn
No,
that,
that's
my
a
dear
Marxist.
brother. No, 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 brother.
That's
Listen to
Marxist.
me. If you are making money off of the backs of somebody else, you're a master. You're a slave holder.
Your
Goodbye, my dear.
statement makes
We'll
you
talk,
a
brother. We'll talk tomorrow. We'll talk tomorrow. Let's go to Johnny. Come on in, Johnny.
Greg Palast was interviewed yesterday by Tom Hartman on Free Speech TV. He's got a movie called Vigilantes Incorporated. You can access this movie for free, and he gives you steps to take with regards to your voter registration at Save Your Vote, SAVEYOURVOTE, Save Your Vote, all one word, .org. You go to that, and that would help counter the negative energy being put out by people like Brian, who are rapidly deteriorating in front of my eyes.
No, the problem with Brian is Brian, I mean, and yesterday on my 3 o'clock show, people wanted me to hate on folks like Brian, right? And I don't. And what I try to tell him is, how can I hate on somebody who actually I would actually fulfill the goal of the capitalists who really depends on us being uninformed. I can't do that. But you're right. Greg sent me the tweet for Greg Palace, good guy, for that new movie that he had, the new documentary that he has out. So I'm going to be promoting that as well. But anyway, I only got 2 minutes, so I got to go, brother Johnny. Thank you for pointing that out. Let me go to Art real quick. Art, only 30 seconds, brother.
So back to the original, health issue. So if you have a dirty fish tank, you don't give the fish drugs. You want to clean the tank. And I use that analogy for our bodies. If we have an excessive amount of toxins and fat, we want to clean our bodies. And the whole deal with Ozempic, there's too many side effects on that. And I know your issue was about
You're right, Art. I agree with you wholeheartedly. I gotta go though. We are on time, but you're right. Thank you, Art. Let me go to the studio. Gleis, close this baby up for me.
Well, nothing from me. Jack, I think, has some notes here that he wants to talk about.
Yeah, we have a sick care system, and labor was replaced by slavery. No, slavery replaced by labor. Now we are wage slaves.
Amen.
I know that, right? Hey, I just wanted to give a side note here to the man who decided he was going to vote. Thank you. Everyone should. If you don't believe your vote counts, at least do it for the people who died for your right to vote. Get out there and exercise your right. That's my soapbox.
And Howard nailed it. Folks, look, love you all. And I mean that from the depths of my heart. We are not going to allow the corporatocracy, the capitalists, to put wedges between us. We have to overcome that. One of the good things I like with the current Kamala narrative is she's bringing that narrative of unity. And I wholeheartedly believe that. I'll fight for my positions. But I tell you what, I can guarantee you one thing. I want just the well-being of us all. Anyway, folks, go to politicsdoneright.com/newsletter is where we have the rest of the show. politicsdoneright.com/newsletter. My name is Egberto Willis. This is Politics Done Right, and you guys know how I end this baby. I am what? Out.
You're listening to the American Democracy Minute, keeping your government buy-in